Okay, so let's begin. And we are live. Hello, everyone. We are so glad you are able to join us today in this new CCD Health webinar. We appreciate the time you are taking to be here. So, to begin with, this webinar focuses on a challenge that many health systems are experiencing right now, which is the growing complexity of scheduling specialty services. Appointments for areas like gastro, radiology, orthopedics often involve detailed prep requirements, authorization workflows, documentation checks, and patient education. And if any of these steps break down, the impact can ripple across the entire system. So from reschedules to operational inefficiencies to denied claims and delayed care. So that's why today we are going to talk about how healthcare organizations can improve complex modality scheduling through precision training. Leading today's session, it's Daniela Hernandez. Daniela, hello, how are you?
Good, I'm great. Thank you, Helen.
Perfect. So Daniela is our Director of Training here at CCD Health, and she works directly with patient access team and healthcare organizations to design training programs that prepare schedulers to manage complex specialty workflows, as the ones we are going to see today. So before we start with all of that, and let's see if everyone else is joining. Yes, more people are arriving. So before we pass that on to Daniela, let's do some quick housekeeping, which is first, use the Q&A tab to send us any questions that you have. We are going to have plenty of time at the end of the session to discuss them. And you can also activate your closed captioning in case you want to read instead of listening. And lastly, you'll receive the presentation slides, recording, and other follow-up resources right after this webinar. So with that said, let's pass it on to Daniela. Daniela, go ahead.
Great. Thank you, Helen, for the introduction, and thank everyone for joining us today. As Helen mentioned, I lead the training department here at CCD. Our team works closely with healthcare organizations to prepare their scheduling teams for one of the most critical and yet often underestimated operational challenge in a patient's journey, which is specialty scheduling. And before we get into all of this, think about this scenario. Or perhaps you can recall a personal experience when you were feeling unwell and your doctor was uncertain of the cause and he orders an MRI. What should be a straightforward process immediately triggers stress, confusion, and anxiety. Your immediate thought is, oh no, this is going to be incredibly complicated. You finally decide to make the call and schedule the MRI, only to face that you need to wait 6 minutes there. And when someone finally answers, they bombard you with all confusing, tormented of complicated instructions and speaking what feels like a foreign language. Restrictions on eating, financial burden, and payment options, confirming if a specialty works for you, and the requirements to arrive an hour early. And all of this, adding to the pain you have when it comes to health, change completely every day, every routine you had planned before. So what most patients don't realize is the true complexity that happens behind the scenes long before you even decide to pick up the phone and make that call. At CCD Health, we manage that invisible complex part of the process to make your call and your overall experience smoother, easier, and less stressful than it would otherwise be. So today we're going to focus specifically on gastroenterology, radiology, and orthopedics because these three modalities represent some of the most operational, demanding, and challenging workflows. While these areas are major revenue drivers for health system, they also unfortunately the source of highest level of friction. During the next 30 minutes, we'll talk about why complex specialty scheduling breaks down so often, what efficient scheduling actually looks like, how precision training involves accuracy, and how AI-enabled scheduling support helps teams move faster. And finally, at the end, you'll witness a live practical example of a very complex, with a very difficult patient scheduling call to illustrate how these workflows function in a real world scenario. So let's start. At first glance, scheduling seems simple. Find a slot, confirm insurance, book the appointment, right? But that's not the reality for specialties like GI, radiology, and orthopedics. Each of these appointments, they carry multiple layers of requirements. For GI, a procedure you need preparation, medical restrictions, and a specific timing window. For imaging appointment, you'll need prior authorization, clinical documentation, modality matching, and equipment availability. And for our third modality, orthopedics, will include referral validation, prior imaging review, and even sometimes subspecialty provider matching. So the scheduling call is more than a simple appointment. It serves as a critical checkpoint. And when this checkpoint fails, the consequences are immediate. Therefore, achieving excellence in scheduling requires a delicate balance between technical proficiency and genuine empathy. So when complexity makes unclear process, frictions show up everywhere. We see it in day of service cancellations, incomplete patient prep, authorization issues, and even multiple calls of the same case, like the same patient, calling to reschedule or something happened and that causes rework. And for our operation leaders, these challenges manifest as like schedule gaps, staff inefficiency, patient frustration, and for our finance team, that impacts directly fell through denials, delay reimbursement, lost revenue opportunities, and client dissatisfaction. These problems ultimately result in both a loss of trust, fidelity of our clients, and a direct financial expense. Honestly, a lot of these problems might happen way before the actual procedure, often right after the very first touch point, the patient scheduling phone call. This means providing scheduling accuracy is one of the most effective ways to improve the patient's experience. Because when our organizations improve performance, it is usually because they introduce like structures and standards. And for this to happen, we need three key elements to align: workflows, prep requirements, and checkpoints. First, clear workflows, where schedulers need to know exactly what needs to happen. Second, confidence in communicating prep requirements. Patients must end the call with a crystal clear understanding of what they need to do. And the best thing of this is that they will give confidence that everything is under control and the patient's health is our top priority. And third are those verification checkpoints that are before finalizing any appointment, details must be confirmed, including authorization requirements, any document completeness, insurance, payment facilities, and accuracy of the modality. When those three elements are in place and are aligned, teams see immediate improvements and results, like in first call resolution, prep compliance, fewer reschedules, and a stronger schedule utilization. Even with excellent knowledge transfer from our training departments, teams frequently struggle in patients' interaction. Success, requires more than just technical skills. A high degree of emotional intelligence, awareness, and empathy is essential for schedulers. This is because patients' reactions and feelings are unpredictable, making it crucial for our schedulers to understand and prioritize the emotional components of every interaction. And that's where support technology becomes critical in our process. When a healthcare organization partners with an external scheduling service like us, they must provide all necessary information, which typically includes patient demographics when they ask for your first, last name, address, phone number, date of birth for verification and for HIPAA compliance. It includes preparation instructions, which are mandatory steps prior to that appointment, like fasting, water only, intake, etc. Modality requirements with specific technical prerequisites, like for example, for an MRI, you cannot have metals, including like brackets or jewelry, or even your nail polish cannot have any metallic thingy. You also need documentations that include make sure you take your insurance card, make sure you take your photo ID and the doctor's referral. And last but not least, our schedulers must follow protocols and procedures to make sure the appointment goes as perfect as planned. And that could be, for example, asking the patient if they need any special accommodation to ensure the facility they are assigned to is properly prepared for them. However, the actual success of the scheduling call is determined by the standards and quality of our schedulers' training in delivering this information to the patient. Simply reading a script, it's not enough. Like effective communication demands a structure, demands a clarity, demands consistency to ensure the patient fully understands the requirement before that appointment. This is why training is vital. It equips our schedulers not just to access the information supplied by the center, but to manage the conversation effectively, leading to accuracy, complete patient understanding, and an in-clinic visit completely flawless. So let's zoom into something else that's been, it's been a lot lately, and it's AI. So let's zoom in one of the most human and at the same time most disrupted areas that AI is transforming, which is the talent. Us as humans. Because while AI is changing systems and workflows and guidelines and all the strategies, its deepest impact is on people. For decades, organizations were built around rigid structures and guidelines. We had a role, we had a defined scope, and a fixed path. But with AI, we're breaking that structure. But humans still remain essential for every process we have. Humans lead, humans decide, and they bring judgment, creativity, and emotional intelligence, which I've mentioned the whole time, is crucial for an excellent call. Here at TCD, we recognize the transformative power of AI to elevate our talent and directly enhance our processes and strategy. Specifically, our AI-powered support is already revolutionizing daily operations. Through this, our schedulers today are expected to manage a huge amount of information in real time. For instance, during a single call, the specialist might be reviewing referral information, verifying insurance details, checking provider availability, confirming procedures prep requirements, documenting the interaction, like everything at the same time. And this represents a substantial cognitive load that one of our AI supports, which is AI scheduling workflow support, can help mitigate. And with AI, we can improve this process and help reduce the burden by acting as a real-time guide during the interaction. Instead of relying entirely on memory, schedulers can receive prompts that help them confirm the correct modality, verify like any required documentation needed for that procedure, identify authorization requirements, and deliver accurate prep instructions. In other words, the system helps ensure critical steps are never missed. And the result is not just accuracy, It's also speed, confidence, and a patient journey, which is excellent. Schedulers, they spend less time searching for answers and more time focusing on the patient, on that person. And on the other hand, we have AI powered accent neutralization that make a meaningful difference. This technology works in real time during the call to adjust the clarity of the spoken communication, helping ensure that the patient hears instructions in a way that is easier to understand. Our goal isn't to change the agent's voice or remove their own identity. It's simply to improve comprehension and clarity during critical conversations in a healthcare environment. For complex modality, that can be extremely important. They are very technical. For instance, when patients need to clearly understand things like when to stop eating before a procedure, how to prepare the day before, whether they need transportation after the appointment, and when to arrive and what to bring. When those instructions are communicated crystal clear, organizations see improvements in patient understanding, prep compliance, fewer cancellation, and fewer repeated calls. So when we combine precision training, AI workflow guidance and schedulers, and AI enabling communication clarity, you create a scheduling environment where teams can move efficiently while still maintaining our high levels of accuracy, quality, and the patient understanding. With AI, what emerges is a complete new model of work, not rigid, but fluid, adaptive, and alive, where schedulers can focus prioritizing our patient's journey and handling their emotions. And with AI and training, from our perspective, talent is no longer something you manage, it's something you continuously develop, deploy, and evolve. So we talk about the principles, right? Now we want to show you what this actually looks like during a real scheduling interaction. For that, we have one of our specialists, Yolanda, who will walk us through a live example of a complex and again very difficult patient scheduling call involving a gastro procedure. As you hear the call, let's focus and let's pay attention on these four things. First, how the scheduler guides the conversation efficiently, how prep and modality requirements are confirmed and transmitted clearly, how structure supports help ensure nothing gets missed, and how the scheduler managed the patient anxiety through empathy and active listening without sacrificing quality or any technical thing. Go ahead.
Thank you for calling a Gastro Center. This is Yolanda speaking. How may I assist you?
Hi, Yolanda. My doctor referred me for an appointment, and I was told to go to schedule it.
Sure, no problem. I'll be more than happy to assist you with that. May I please have your full name and date of birth?
Yes, it's Laura Bennett with double T. My date of birth is July 8th, 1982.
Thank you, Mrs. Bennett. Let me go ahead and pull up your chart and so I can go ahead and verify your account, okay? Allow me just a moment, please, on the line. Is that okay?
Okay.
Mrs. Bennett, thanks so much for holding on the line. After reviewing your account, I do see here that we have received a referral from your GI provider. This is for a fiber scan exam.
Fiber scan. That was it. What is that exactly?
Well, it's like a painless ultrasound used to measure like liver stiffness and also to check for any fat accumulation.
Okay, I got it. Thank you.
All right, perfect. So before we schedule, I would like to walk you through a few quick requirements to make sure that the tests can be complete like successfully and so like that you have an idea on how the exam will be performed. Is that okay?
Yes, that's fine.
All right, perfect. So for this exam, you need to be fast at least 3 hours prior. That means like no foods, drinks, no coffee, mints. And Mrs. Bennett, are you taking any medications?
Yes.
Okay, perfect. So in this case, not a problem. Just make sure that at the time or before, the 3 hours and take the medication very early in the morning. And it has to be just with a little bit of sip of water, just to make sure just to take the medication down. Is that okay with you?
Yeah, that shouldn't be a problem.
All right, perfect. So next for you to know is that during this scan, you will need to be like to lie flat on your back for about 5 minutes. So before and during the procedure. So like that also you have probably to be like bent on your knees slightly just for a little bit of comfort just to make sure that these scans are properly performed. Is that okay with you?
Yeah, I can do that.
All right, great. So you will also need to position your right arm either above your head or cross your chest during this procedure just to make sure that there's not any movement at the time that the machine is working and taking the images, because then if there's any movement of your body at that time, we will have to repeat the image and you will have to, to come back. So we don't want that. So we want to make sure that this exam is perfectly performed, so you don't have to be back and forth. So, do you have any issue with your comfort, like mobility or anything like that?
No, that'll be okay.
All right, thank you. So, this is my last question. Have you had any recent like surgeries or procedures in your abdomen area,
No, I
like
haven't.
like in 6 to 8 weeks? No?
No, I haven't.
Okay, good to know. So, also, I was forgetting to tell you that also the exam requires for you to bend slightly on your waist. Okay, so this is just because of the same thing that I just explained about that we need to make sure that there's not movement, okay, and that we are able to take your images complete, and then the images will not come up clear enough, okay? So, do you have any issue with that? Is that okay?
Mm, yeah, it's okay.
Alrighty, perfect. So let me go ahead and verify the insurance information with you. So I see here on your chart that you have Aetna. Is that still your insurance?
Yes.
All right. So for fabric scans, some plans require prior authorization. I'll be sending the information to the clinic. So, like that, if anything is needed or any authorizations if is required, they will have to, they will verify the information for you. And if anything, they will give you a call back prior to the appointment or give you the information at the time of the appointment. Okay?
Okay, thank you.
Alrighty, perfect. So let's go ahead and check for you what would be the next available appointment. Do you mind to place you on a brief hold while I verify the information?
Okay.
Thank you. Just a moment. Mrs. Bennett, thanks so much for holding on the line. So the next appointment available would be April 19. Would that work for you?
April 19th? That's 3 weeks from now. I can't wait that long. This pain is unbearable.
Yeah, I understand. I'm very sorry for that. The thing is that the our radiologists are pretty booked, but let me go ahead and verify with the clinic, to see if there's any way we can squeeze you in anytime soon. Okay, just a moment.
Yeah, okay.
Alrighty, Mrs. Bennett. So I confirmed with the clinic that I can go ahead and squeeze you in. The soonest I can give you will be March 31st.
Okay, much better.
Okay, perfect. So let me tell you something about this time. For March 31st, you will be overbooked with another patient. So that means that you might be able to, or you might have to wait around 10 to 15 minutes. So they finish with the patient that would be with you at the same time, which is 9 a.m. in the morning. Would you mind waiting 10 to 15 minutes while they finish so then they can go ahead and start with you?
It's better than a month. Well, go ahead.
I know. Okay, perfect. So great. Let me go ahead and get you scheduled then for March the 31st, Tuesday, 9 a.m. Please arrive 15 minutes early for your check-in. Also, just to make sure that we got everything complete and you have all your information down. You are scheduled for your fiber scan, right? On Tuesday, March the 31st, 9 a.m. in the morning. Remember that you have to be fasting, okay, 3 hours prior your medication, as I mentioned, okay, for you to take it. Just make sure you take it with a little bit of, sip of water just to get the medication down, okay?
Got it.
Also, just so you to know, a detailed information will be sent to your email and text message along with a reminder the day before. So if anything changes prior to the appointment, they like say that you're not able to show up, the time won't work for you, please make sure that you give us a call just to let us know ahead of time. Is that okay?
Okay, I will.
Wonderful. So perfect. That's great, Mrs. Bennett. You had been scheduled for, as I mentioned, March the 31st, Tuesday, 9 a.m., 15 minutes arriving time. Is there anything else I may assist you with?
No, that's everything. Thank you so much.
My pleasure, Miss Bennett. Thanks so much for calling. I'll look forward to see you. Bye-bye. Have a wonderful day.
Bye.
Great. So thank you, Yolanda and Ms. Bennett, for this demonstration. And what we just heard completely proves our point. Effective specialty scheduling happens when teams are supported by a structured training with clear workflows, relevant supporting tools, and soft skills that help manage all of that patient's emotion. When those elements are in place, our organizations can significantly reduce scheduling friction and improve both operational and financial outcomes. Thank you so much for your time today. Helen, I'm gonna go back to you and ask you if we have any questions.
Thank you, Daniela. That was wonderful. Thank you for walking us through all of that. And now I think we've received, let me check, we've received a couple of questions. Let's see from the audience. So let's go through them before we wrap up. Okay, so first one, for organizations that already have high cancellation and reschedule rates, where should they start looking to improve all of this?
Great. Because that's a lot of organizations see the symptoms, like the symptoms, cancellations, reschedules, prep issues, but the root cause is often earlier in the process. The first place to start is by looking closely at how complex modalities are being scheduled today. In many organizations, schedulers are doing their best, but they're navigating different instructions, different protocols, and sometimes incomplete information. So the first step is really standardizing the workflow of those specialists. That means defining what needs to be confirmed during the prep call requirements, authorization checks, documentation, and the correct procedure type. Once that structure is in place, training becomes much more effective because schedulers are learning a consistent and standardized process rather than trying to memorize expectations. And then the third layer is providing real-time support tools that help schedulers follow that workflow during the interaction. When those three things work together, clear workflows, structured training, and real-time guidance, you start to see meaningful improvements and results in the scheduling accuracy and fewer downstream issues that might happen.
That's wonderful. That's wonderful and very, very, very accurate. So here we have another one. This is actually a really good one. So you talked about AI-enabled scheduling support. So how does that actually fit into the workflow of any scheduler without making the process more complicated?
So this is something here at CCD we've been addressing since we started showcasing our AI-powered capabilities. The goal of AI in this context isn't to add more steps, it's to simplify the decision-making process for the scheduler, letting them focus on judgment, critical thinking, and like emotional intelligence. During a scheduling interaction, the agent is managing a lot of information all at once. They're confirming patient details, they're reviewing referrals, they are checking providers' availability, and explaining instructions. What our AI tools do is that they help to provide a contextual prompt during the whole call. For example, let's say if a specific procedure requires certain prep instruction or documentation, the system can surface information at the right moment. So instead of the scheduler trying to remember every protocol for each modality or for every single thing with details and everything, or search for it manually, the system will help guide them through the process. And then they'll make the decision on what to transfer or to transmit to the patient. What that does is reduce cognitive load, improve consistency, and allow the scheduler to focus more on the patients and be a little bit more empathize with them.
Thank you, Daniela, again, and thank you, everyone. I think this is a wrap. Thank you so much for joining us, and we'll follow up with additional resources. Thank you so much for today. Bye-bye.
Bye. Thank you, Helen.
Bye.